My presentation is going to focus on a specific research project looking at maternity experience for Gypsy and travelers women, and the type of research we deploy use art as a medium to convey some of the messages. So I will spend the next few minutes to explore how creative methods promote inclusion in the research, which I think Dalvir already explained quite a lot in that context, but also most importantly, how storytelling, how visual representation can promote work and engagement with underserved communities. Part of the presentation will be highlighting some of the insight from the maternity inquiry. Obviously, given the time space we have, that will be quite limited, but I will signpost you to a further reading on this. And lastly, I will look at some key consideration for public involvement while working with Gypsy and travelers, and actually how art can be one of the medium when we bridge that cultural divide and challenge some bias and things what exist sadly in our society and service provision. So before moving to specific example of the art project we did around maternity experience, I think it's really important to look why inclusive research matters. You know, we use lots of terminology about, you know, making things accessible, inclusive. I think Dalvir presented fantastic example of, you know, how you can deploy that in practice. And actually using slightly different method, different approach to this. We know it works. So, you know, by just doing traditional things as we always done, create the danger of excluding marginalized voices and, you know, this number of groups we could identify with this. From the perspective of our project, we felt art was a medium which created the universal language, particularly for groups where probably literacy is quite limited, or people who do not speak English is a really nice vehicle to create that. But most importantly, I think whatever we do is a service provision, is providing care, undertaking research. I think it's really important we guided by the key element of our principle, which is about building trust relationship, but actually making the engagement impactful, not just for our services, our research purpose, but actually for the community itself. And also, I think it's really important to acknowledge is that ownership element. So particularly within our project, which I highlighted later in my slides, is we created the ownership between community, the artists, and the research team. So that's again create a very nice space in terms of longevity and sustainability of that. And obviously the key theme of is co-production. So it's not just done by us, but actually working together with the community. So why we decided to undertake work with Gypsy and travelers women and looking in the maternity experience? I think many of you on the call would not be surprised, you know, historically this is very underserved, and the research group face many systematic barriers in stigma. I could probably put a number of different policy reports, documents which highlighted the inequalities for Gypsy and travelers, and this is just a small sample on the screen. In terms of our research and context where we are in Leicester, we obviously got quite a substantive Gypsy and traveller community with over 70 sites. Okay, thank you. Apologies for that. So in terms of our sort of local context, we obviously got quite substantive local community. Having said that, you know, communities suffer from a number of poor outcomes when it comes to health. That includes, you know, a high level of mortalities, number of, you know, long-term condition, but particularly in terms of, you know, maternity, there's, you know, low level of undertaking screening, perinatal inequalities. And actually, if you look overall in terms of the life expectancy, when it comes to Gypsy and Roma individuals, the life expectancy is about 25 years shorter to a normal wider population. So that's starking health inequality. And I think, you know, for someone when we use the phrase old age for someone in the Romanian travelers community, that's around 60. So that's, again, is looking from the context. And obviously, alongside of the health inequalities, we have to look from the intersectional element and disparities. So we know this high level of unemployment, social inclusion, low literacy, and a number of other inequalities would sort of exacerbate some of the inequalities. So we did the project between 2022 and 2023, involve, like I said, using art as a methodology to collate feedback from our session, but also curate exhibition, which could be a vehicle for empowerment, for advocacy, and something the community can take with them. So part of the research was about exploring the whole maternity journey, looking through, neonatal, postnatal, and but actually a community support as well. One of the key elements of our project was looking actually how influence of ethnicity or culture play a part in terms of accessing service, making decision about healthcare, seeking support. So that was sort of underlying theme. Through the project, we co-curated a peer-led workshop. So we work with artists and the community, and it was very much so about led by the community. And the final dissemination aspect was concluded with a community-based exhibition in a very sort of community-based setting. And then we've got the exhibition, which travels across different venues. So in terms of the methodological approach, what we did, we have a focus group with Egyptian travelers women. We also had a semi-structured interview with midwives. As I mentioned before, we had the art workshop where we curated some of the artwork, but also we conducted a systematic review looking at a wider issue in terms of existing literacy and some of the things highlighted in terms of inequalities as outcomes. So the next few slides are going to be example the artwork we really created with the community, which highlights the sort of key themes of our research. So the first one was around the cultural differences between what is the expectation and reality when it comes to the Gypsy and traveler women. So the whole expectation in terms of maternity care is about, family center, very traditional birthing practices and gender role. And then when it comes to reality, some of the feedback we were getting, most of the feedback we were getting, it was about, is very clinical, is very, medicalized. There's no space for that holistic approach. Obviously, this is a sample of community we discuss. So again, there will be limitations in terms of people experience. Part of the discussion was also about accessing services and how people felt, there was the fear of judgment and discrimination, particularly when we're asking about equality data and monitoring form. So the image itself, it creates that sort of dual perspective where on one side you have the health professional advising and providing that information, and then on another side is the community advocacy provided by the older member, older women, mothers, aunties, and so on, and the mother is in the center, which could be quite challenging in terms of who do you listen to, which perspective to counter. The second aspect, the thematic aspect of the work, it came around respect, and the image itself, it was something that was strongly advocated by the Gypsy and travel women in terms of, the representation of the culture, life, and tradition, how important that is in the maternity journey. So the whole process of preparing and actually being ready, the whole community, family being part of it, very colorful, very vibrant, and also identifying how important the gender role is. So, even within a society where we're moving and transiting different roles in the Gypsy and travelers community, traditional model is really, really still quite common. And I think that was also highlighted through the discussion. The next image is about congratulations. So again, the babies arrive, the mothers leave the hospital and become part of the normal living. And I think the pictures itself highlight the complexity, the dynamics between the healthcare professional, where in the normal circumstances, women are advised to take a rest, prepare themselves, take that extra care after the birth, because that is really important. But actually for the Gypsy and Traveller women, one of the things that identify and talk quite a lot is, when we're expecting a visit from care professional, a lot of the time we have to prepare the caravan, we have to clean, we have to spend time, and actually, is again the reality and understanding how culturally that is important and embedded. And also the whole sense of pride and joy of having new babies. So one of the key messages from the artwork is really sometimes how this conflicted priorities and the limited cultural understanding from some healthcare professional could create, misunderstanding, miscommunication in maternity care. The next picture is really about a fatalistic approach to health, and the artist decided to create this baby vest. And if you look closely with the baby vest, there are quotes from the focus groups and the conversation we have, and actually looking from the whole journey, from the conception, some through the marriage to the maternity, and another element of child upbringing. And actually part of the conversation was about, the high level of baby mortality, and what is the view of the community and how do they see it. So through the conversation it was quite clear. Lots of women highlighted the fact is a godsend, is a something decided beyond the control, and there's no impact in terms of how they can improve this. So again, it's interesting how probably there needs to be a little bit more advocacy and information in terms of it's not just a fatalistic way. It's about how do we bring that message to the community and the understanding of some of the risk factors. And again, I think there was lots of practical challenges. The women sometimes left alone because the husbands, the partners are focused on that sort of bread bring element of the. So there was lots of sort of pressure, complication, and challenges for the discussion. The last two artworks focus more about the future and actually how we can improve some of the challenges, some of the themes highlighted in the discussion. So those images represent solutions, some of the key consideration, and the tree of life is, how do we foster greater spaces for discussion, open dialogue? How do we increase the cultural awareness from healthcare professionals and researchers as well, in terms of maybe some of the historical understanding, the preconception, some of the expectation people might have. So that was a little bit more, ambitious and looking forward, but actually it was recognition, women from the Gypsy and Traveller community, they really want to have that open dialogue and understanding, and at the same time the recognition their culture is really important to them and heritage in the maternity journey. So just few reflection from the project. Obviously, part of this was creative artwork, but actually the artwork itself, it focused on expressing the cultural identity and experience. We felt we were enable the space and a platform for the unheard voices to be heard and actually visually represented. Part of the project will also bring the research team to local community and being part and building that trust and relationship, notwithstanding some of the challenges we face, around stigma, literacy, the general research fatigue, general sort of low engagement from people. But actually one of the probably most important things is about how do we deliver that. And I think Dalvir mentioned in her presentation around being culturally sensitive. And I think that's sort of underlying thread throughout the work in terms of the engagement, the research, the dissemination, and what happened after. And I think again, one of the things that was highlighted throughout the conversation is about how do we empower community members from the Gypsy and Travel community to become these advocates, to become, something they can provide a bridge between community, healthcare professional, research team, or whoever is there to support them in that journey. And obviously, from our point of view, the visual narrative created that bridge between both angles. This is just few considerations, which I think already Dalvir mentioned some of the things. So obviously the trust, the relationship is really important, and cultural competence, how do you navigate that discussion and conversation? And I suppose one thing I would probably highlight it in this is, we talk quite a lot in this sort of umbrella terms, Gypsy, Roma, travelers, but this is really important for the community. How do we distinguish this group? Because they have their own identity and culture, and I think the way we convey that message is also really important. And I would say one of the key things is about time you allocate, the motivation and the tools. So you can't do it very quickly. It takes a lot of time, and I think that's also important to recognize in your planning, in your project delivery, in the whole conversation. And on the infographical side of the screen, you see some of the key consideration. And this is just a reflection on my journey. So actually, when we're talking about time and how long it took me to build a relationship with the Gypsy and Traveller community, is about 10 years. And it was not easy. I think now I've got the open door policy, I could say, but actually it takes a lot of time, like lots of motivation, but also lots of sort of encouragement, and actually it's a two-way conversation. So you have to give something back to have that, so they can give you something back as well. So just to be mindful of, and I just want to acknowledge my colleagues who took part in the research and our fantastic artists who created this amazing artwork. So thank you very much.